Hi, my name is Jason Long, and I am here to present a project proposal for the implementation or evaluating the implementation of a congestive heart failure nurse program. Just a quick background on what congestive heart failure is. As we all know, it is a progressive disease that occurs when the heart is unable to pump sufficiently to maintain the body's needs. Signs and symptoms include dyspnea, fluid retention, fatigue, and overall decline in physical functioning. Bradley et al. In 2013 identified congestive heart failure as a major public health issue with a prevalence of over 5.8 million in the U.S., a leading cause of health services utilization with a cost of over $39 billion annually. Bui, Horich, and Fonaru in 2011 identified congestive heart failure as the most common diagnosis in hospitalized patients aged 65 years of age and older, and reasons such as noncompliance with treatment, lack of knowledge, suggest that many readmissions can be prevented with a proper plan of care and adequate teaching. So therefore, the goal of this evaluation project proposal is going to be to improve nursing knowledge overall to help reduce unnecessary congestive heart failure readmissions. This will be a randomized controlled trial. And what we're going to be looking at is the comparison of readmission rates, lifestyle modifications, cost of care, and overall quality of life between CHF patients who receive CHF nurse management education from a specific CHF nurse or advanced practitioner, and those who receive usual standard of care from general staff nurses. So after seeking approval from the IRB, the study will take place at Roper Hospital in Charleston, South Carolina. Inclusion for participants will be those who are on an inpatient status at Roper Hospital with an admitting diagnosis of congestive heart failure, age 65 years of age or older, with an independent level of cognitive functioning. Excluded from the trial will be those who have cognitive impairment, an unwillingness to participate, or those with a terminal diagnosis. The study group will receive 1 hour of care, 1-to-1, from a CHF, specially trained CHF nurse or advanced practitioner during their hospitalization. The control group will receive just your standard of care from a non-specialized nurse. And following discharge, trained surveyors who are blinded to both groups will follow the participants for 12 months with weekly phone calls evaluating their knowledge and lifestyle modifications concerning congestive heart failure. And further, the principal investigator for this study, which will be me, will monitor for readmissions and mortality for the patients participating. Our outcome measures will be evaluating CHF readmission rates, mortality, CHF self-management knowledge, as in medications, dietary lifestyle modifications, daily weights, and reportable signs and symptoms. The trained surveyors will also be asking the participants for any type of satisfaction or feedback from their providers that they met with during their stay. Following data collection and analysis plan, all data will be stored in a clinical information system, and each patient will be provided a unique code identifier in which only the principal investigator will have access to the code key. Comparative data analysis of the two groups should be made at the end of the investigation, and yielded results will be evaluated for evidence-based care practice suggestions. In conclusion, this project proposal is aimed at improving the quality of life in those individuals suffering from congestive heart failure and reducing 30-day readmission rates through the utilization of current evidence-based guidelines and the development and implementation of new initiatives to meet service delivery gaps. Hopefully, at the end of this project, we will be able to enhance education and training of healthcare professionals to deliver optimal care for CHF patients. Thank you for your time.